This consultation has been very important for me. The most important thing that I learned is how we need to engage communities if we have to win the war against HIV.
This for me is a game changer, and the fact that we are now talking community level factors, we're actually talking about something that resonates with the profile of sub-Saharan African communities.
But they're not usually at the forefront or one of our key objectives in the work. And this consultation helped me reflect on that and recognize how, in moving forward, they really need to be.
I've certainly evolved a lot in my understanding of the different factors, the meaning of those factors.
So to focus on individuals without looking at community level factors, we're missing a lot.
Researchers and programmers usually use a top-down approach instead of using a bottom-up. And in using a bottom-up, it means that the community involvement is right at the beginning.
For me, it's just second nature. I mean, absolutely everything we do requires a robust community platform to deliver.
To me, that suggests that there is a big place for community-level interventions in terms of raising awareness and garnering support for the interventions that we're trying to provide to people.
And once we understand those things, we find ways to improve them so that they do work.
I think if we do that, we're likely to have a greater impact than the individual-based interventions, because the community knows best what the problems are, and they're likely to point us to what we should be focusing on.
This is one way in which they can really be taking things up and looking at the areas of HIV from different perspectives.
From this consultation, I've learned that measuring community level factors is not an easy thing. There's no one way of doing it. You need several methods.
The place to always start, I think, is with RCTs, cluster-based or community-based randomized controlled trials. In terms of, those are the best way we have of measuring the impact of interventions.
And a big part of that is really looking at appropriate qualitative means.
And if that is standardized, then we'll be able to compare one country, one community to another.
And then be able to say if we are able to tackle this factor or if we are able to strengthen this one, that would have an impact on HIV outcomes.
So this is really the task ahead of us, is to not only take stock of the evidence, share that evidence more widely, help people to understand how the evidence can not only inform decision making but also the programming.
And if we can establish that, then we will be better able to measure both what the needs are and what the interventions have done and or not done.
As a result of this consultation, there are many things I intend to do, actually. But I think one of the biggest one is really just to make sure that the community level factors do stay at the forefront of our conversations, of our interventions, of our measurement and evaluation.
The consultation has opened up and showed me that I was narrowing my thinking of what community level factors are and that I need to broaden that up.
As a result of this consultation, the most important thing is just going to be getting what we talked about out to everyone else and bringing more people into the conversation and encouraging other people to really look at community level factors and their impact.
One of the things that I would like to do is to see how the community dialogue model can be championed as one of the models that can be used as far as understanding community level factors, but also bringing changes that can, affect the HIV prevention outcomes that we're focusing on.
From this consultation, I'm definitely going to intensify my work in the communities.
So I'm going home geared up and fired up to go and continue the work.